Good evening, everyone. Thank you so much for being here and welcome to the Everything You Need to Know About Studying Dietetics and Becoming a Dietitian. This is hosted by Future Frontline. We are an online group of students who are training to work in the NHS. We are the multidisciplinary team of everyone you can think of, and we are so excited to host this. We are on all social medias. We have a podcast and we have a website, and it's all a Future Frontline. So please follow us, get to know us, and we can't wait to get to know you as well. As Future Frontline, we want everybody to know that the NHS is more than just doctors and nurses, and we believe in a future with collaboration at the centre of everything we do. We really want to show you and everybody that the multidisciplinary team works together within the NHS and other settings to put the patient at the centre of our care. Socioeconomic status should never be a barrier to pursuing a career in healthcare. That's why all our events are free and recorded and saved for future reference. So once again, thank you for being here. Okay, I think the waiting room is empty. So I shall start. My name is Laura. I'm a second year dietetics student studying at Cardiff Met. I am currently on my first placement. I'm about halfway through and I'm an undergrad student. I think I said that already. But I have two people with me tonight. Amira, who is another student dietitian and a qualified dietitian. Amira, do you want to introduce yourself?
Yes, hi everyone. As Laura said, my name is Amira. I'm a final year student dietitian studying at King's College London, and I am currently on my final placement before graduation, hopefully. And we'll be excited for starting this session with you all and happy to answer any questions in the end.
Amazing. And Estelle, do you want to introduce yourself?
Yeah, sure. So my name's Estelle. I'm a registered dietitian. I'm working in Manchester in an acute hospital, and I qualified in July 2020. So I'm still kind of a new graduate. So yeah, looking forward to the event.
Amazing, thank you. So tonight is going to look like a bit of a discussion between the three of us on our experiences and future expectations and everything in between, all about being a dietitian or studying to be a dietitian. At the end, there will be an opportunity for questions. So save them till the end and pop them in the chat box, and hopefully we will get around to answering all of those. So first question for the three of us. Why dietetics? And yeah, how did you decide to become a dietitian? Estelle, do you want to go first?
Yeah, sure. So I suppose dietetics as a profession, it's obviously science-based, and it kind of integrates that, aspect of nutrition with the kind of evidence base as well. So I've always had an interest in science. I knew that I wanted to work in healthcare, and I've always kind of had an interest in nutrition. So when I was in school, I originally thought I might like to study nutrition. I'd never actually heard of dietetics as a degree. And through just doing some further research, I came across it when I was in my 5th year in school. So that would be like lower 6th in the UK. And I kind of looked into it. So I went to school in Ireland. There's only one undergraduate course for dietetics in Ireland, actually. So I knew that it would be quite competitive to get into. So yeah, I was quite proactive with applying to the UK, and I just kind of took the leap. So I actually did my degree in Edinburgh. So yeah, I guess, the whole time leading up to moving across to Edinburgh, I just got as much kind of work experience as I could get. My mum's friend actually worked as a dietitian, so I spent some time shadowing her in her clinic, and I also spent some time in the local hospital as well, shadowing dietitians on the ward. And I think after that, I just really knew that it was the profession for me. So yeah, and I definitely don't regret it. It's been it's been a good journey, definitely. And I suppose I've learned so much along the way as well. I guess maybe the reasons I kind of went into dietetics might be quite different to how I kind of find the profession now. And I definitely think, obviously, there's a wealth of misinformation out there when it comes to nutrition, and I think through studying the degree you just gain so much knowledge and experience, really. So yeah, what about you guys?
Amira, do you want to go?
Yeah, sure. So it's kind of similar. Back in high school, I remember I just have always imagined myself working in healthcare, but I just didn't know what in healthcare. But then I just realized I just love food and nutrition. So I was just thinking, dietetics, basically combining my love of food and nutrition with more scientific evidence base behind it. And then that's when I knew dietetics is the one I wanted to go through, basically. And I also remember I shadowed a dietitian back home. And yeah, it was just also another part is that in where I come from back in the Middle East, a dietitian is seen as just someone who is basically, I'm just going to write you a meal plan and make you lose weight. So that is basically our job back there, which is absolutely not. That is not what we only do. So I think that's when I started researching more about it. And then I found in the UK how a dietetics course is, the whole placement, how you get 3 placements in the course, and how you get so much exposure to so many acute areas, clinical areas, the community. And that really pushed me towards going through and seeing what dietetics is really about. And so far, really enjoying it. Placement is amazing. That's literally where you learn the most as well. And yeah, I think it just all started with a love of food and science.
And for me, again, really similar. So both my parents are in the NHS, and I always wanted to work in the NHS. I think I went through every different role you could be. I wanted to be a physio. I think I wanted to drive an ambulance at some point. So it keeps going. I don't really know how dietitian became the one that I stuck to, but I'm so glad I did. I think I decided in about year 10, which seems an age ago now. And once I found it, I shadowed some dietitians. I knew it was exactly for me. And since being on placement, it's just reinforced that. I love food and I love helping people. And I love like the aspect of working in a hospital. So yeah, that's how I ended up here. So next up, what is a typical day in your week? A typical day, yeah, typical day in your week. So I'll go first if that's okay. So as I said, I'm an undergraduate student. I'm second year and I'm on a 3-year course. So currently I'm on my first placement, which is 6 weeks. Every university does their placements differently. So if your first placement was in first year, that's probably normal and however long it is, but mine is 6 weeks and I'm coming to the end of my second year. A typical day for me is 9 till 5 in the hospital. Sometimes it's the morning in hospital and the afternoon online. Due to COVID, the office space is really small. So I have a lot of webinars with other student dietitians from my course, which are really interesting and informative. And then around the 9 till 5, I have to fit in some essays because I write essays throughout placement, which is stressful, but it's worth it. I have Saturdays and we get half a study day per week. So I usually take myself off to the hospital library and manage to get a bit of essay writing in here and there. In terms of other things, I do find time to spend to ring friends. I'm currently in Northwest Wales in the middle of nowhere, so I don't know many people here, but that is the wonders of Zoom and technology. But yeah, I like to run. I'm about 1 minute walk from the beach, so I'm making the most of West Wales. And yeah, that's my current typical day.
Estelle, do you want to go next? Oh, I think you're new.
Sorry. I was going to say, do you want to go first, Amira? Because my day in the life is probably quite different to both of you.
Okay, I'll go first. So as I said, I'm a final year student. I'm currently done with exams, dissertation. All I have left is placement and I'm midway through. So my whole day is basically just being on placement. It's either from 8 to 4 or 9 to 5, same as Laura. And so it just starts like usually we would have the morning to prep for patients and then go see them in the afternoon on the wards. It just varies every day. And the way how my placement goes is that we rotate every 3 weeks with a different team. So then one on the first 3 weeks you'd be with gastro, and then you'd go with like oncology, and then you'd go with like acute general medicine. So you do come some form of rotation, which is really nice to see a lot of exposure to other clinical conditions. And so yeah, I'd be from work from 9 to 5, prepping, documenting patients' documentation, speaking to patients, speaking to dietitians as well. So that's basically it. Also, as part of my placement, I do run clinics. So besides just doing that on the wards, we also have clinic days. So that's going to be from 9 to 12, 9 to 1, and then the whole afternoon would be just admin work. I really underestimated how much admin work there is as being part of a dietitian until I started being on placement. But yeah, so far really enjoying placement. So and then after 9 to 5, usually I would be tired to do any form of more work. And then that's how my day ends basically.
Great. Well, I go next. So yeah, I suppose my day in the life is quite similar to yours in a way, Amira, I suppose, with you being on placement. So my working hours are 8 until 4. So I work in an acute hospital. I actually work within a smaller team of dietitians. So a lot of graduate dietitians do rotations. So they might be within one specific specialty for like 6 months and then rotate. For me, we're quite a small team, so I've gained experience across many different specialities. So yeah, essentially a typical day for me, drive to work, get there just before 8 o'clock, and then kind of, settle in, check my emails, and we go through like all the new referrals we've had that day. So we have a lovely dietetic assistant who helps us with that. And then we prioritize the patients that we have for that day. So for example, any patients requiring like tube feeding or parenteral nutrition, which is like IV nutrition, we would see those within 24 hours. And then any patients just requiring other kind of oral nutrition support or dietary education, we'd see within like 2 to 3 days. So yeah, I suppose I just kind of team up with my colleagues and we kind of see what our caseloads are like for the day, and then we kind of divide the patients out. So I do have set wards that I cover, but they're across various different specialities. So I cover, some gastro, surgical, respiratory, trauma and orthopedics, care of the elderly, bit of everything really. So yeah, I kind of spend the morning gathering, all of the information that I can from the office. So we kind of look at the computer systems, we have a look at the patients, like anthropometry, that might be like their weight, their height, looking at their BMI, any like weight loss or anything like that. And then we actually look at the bloods as well. So it's quite an important part of the dietetic assessment actually, that a lot of people don't realize. So, we're looking at hydration status and whether they've got infection markers raised and stuff like that. And then we'll look at the patient's medications as well. So I suppose as part of the dietetics degree, we do pharmacology modules as well. So we need that kind of baseline understanding of medications and their kind of mechanisms of action and side effects. So we would look at medications and I'd maybe look at why they were admitted. And then once I've gathered all of that information, it's usually around between 9 and half 9. I'll head to the wards and I'll see as many patients as I can before lunchtime. And then we get half an hour for lunch. And then the afternoon, I'll usually see some reviews that aren't quite as high priority. Or else, a lot of admin work. So for example, handing over to community dietitians and doing GP letters. So I'll ask GPs to do prescriptions for supplement drinks. Again, just kind of updating stats and, online caseloads and stuff like that, and just kind of getting organized for the next day. And I finish at 4 o'clock, although I don't usually leave till about 3:30, which is probably my worst habit. And then, once I get home, I'm usually quite busy in the evening as well, doing kind of extra things. I guess when you first start as a band 5 dietitian as well, you almost still feel like a student and you're still kind of reading up on stuff in the evening. So happy to say I'm finally at the stage where I can come home and switch off and just relax, which is quite nice. But and I suppose in a typical week, I do an outpatient clinic every 2 weeks. And at the moment, that's a telephone clinic just because of COVID. But hopefully it'll be going back face to face soon. So that's kind of what a typical day looks like for me.
Thank you. I think that's something that really surprised me about placement, the prep before you go and see a patient. There's so much research you have to do. And I really enjoy it. And it's just a step that I didn't really think about till I got to placement.
Definitely. I always find like I'll be on the ward and, you know, when the doctors or nurses might be like, oh, this patient needs to be seen. Can you see them right now? And I'm like, actually, no, because I need to look through their bloods and their medications and everything beforehand. And I think it's something that they don't realize. They kind of assume, oh, the dietitian just comes to the ward and tells the patient what to eat, which, yeah, can be a bit infuriating, but yeah.
Yeah, okay. So the next question is specifically for you, Estelle. I would love to answer it, but as I'm not qualified, I probably can't say. So the skills needed or what you think need to become a dietitian? I mean, I probably could contribute, but I'm not qualified.
Yeah, definitely. So firstly, I suppose in terms of kind of clinical knowledge and skills, I suppose we gain that kind of overview at university, and that's why we have, you know, different modules that kind of give us that kind of baseline knowledge of, you know, clinical sciences, you know, pharmacology, genetics, immunology. It's going to be different for every university, obviously. But I suppose, you know, at uni it is really important obviously to learn that baseline information before then starting placement and, you know, applying it in practice. So I suppose in terms of one of the most important skills, obviously it goes without saying communication skills are, you know, imperative to being a dietitian, and that includes both, you know, written communication skills and verbal communication, and that's with both colleagues and with patients. So obviously as dietitians working in a clinical setting, we work face to face with patients. You know, you need to have those skills to build a rapport with patients, you know, demonstrating like active listening skills, even things such as maintaining, you know, appropriate body language and eye contact. And I've definitely found through obviously starting my career during a pandemic, and I suppose you guys probably find this as well on placement, wearing PPE can be quite challenging because many patients can be quite hard of hearing, for example. They might be used to lip reading. So obviously, you know, you're wearing a mask, potentially a visor as well. It definitely creates a lot of communication barriers. So I think we've even learned to just like really adapt our communication skills as well. And I suppose as well with, you know, telephone clinics, that can be challenging as well, you know, having to carry out clinics over the phone and not being able to, you know, meet patients face to face as well. I suppose in terms of communicating with colleagues, again, that's really important, and it's important to maintain that professionalism as well. So I think we'll go into that a bit further down the line, just, you know, talking about working within the MDT. But I would really emphasize that it's important to really be able to kind of stand your ground as a dietitian and recognize that you are the expert in nutrition. So I would say, you know, at times having those reasoning skills, particularly with, you know, medical teams as well, you know, providing our input as the nutrition experts. I'd say being quite adaptable and flexible is really important. And I wouldn't say it's a skill you necessarily need right now, but it's definitely something that you will learn to develop. And I would say personally, I don't think I ever would have considered myself adaptable and flexible maybe like 4 or 5 years ago, but working through a pandemic has definitely taught me to be quite flexible. And I suppose, you know, that's even just in terms of reprioritizing my caseload every morning. You know, I might have planned to have seen a certain number of patients, but actually, you know, we've got some new referrals come in and I've had to reprioritize, or with staff shortages having to cover for people and stuff like that. So just being adaptable and flexible is really, really important. And I guess being a team player as well. So obviously working within the MDT, but working with your dietetic colleagues and kind of checking in on them, seeing how they're managing things and providing support where necessary. And again, demonstrating that kind of active listening skills and stuff like that. And yeah, being able to kind of educate others too. So, you know, dietitians often provide education to nursing staff, for example. So recently, like I've done anthropometry workshops for nursing staff, and I suppose that kind of links in with presentation skills, and that's something you definitely learn at university and develop. So yeah, I suppose there are many skills I can think of, but I think those are probably the most important ones.
Something you'll never hear enough as a student dietitian is how important communication skills are.
Yeah.
Every lecturer, literally every person will tell you, but it's so true. And I found, particularly being in West Wales, a lot of people speak Welsh as their first language, and their English can be like quite poor or non-existent. So I've either had to ask someone who speaks Welsh to translate, or it's speaking a really simple English and making sure you're making eye contact and just being so respectful, because you can't presume everyone is going to understand you and understand like the level of words that you use. That's doesn't make sense. But just, yeah, like simplifying what you know, because your brain is full of science and biochemistry and everything you've been taught at uni, into something that a patient, an elderly patient who has dementia, whose first language is Welsh, can understand. And you just can't learn that at uni. You have to learn it on placement. But it's really challenging, and it's good. I enjoy it.
Yeah, to add up on what you just said, like most of those skills would obviously you know about them in university, they'll teach you about them, but you won't gain them properly until you're on placement, because that's when you're actually going to implement what you've learned. So like in the beginning of placement, oh my God, I thought I had the skills, but no, I did not. I did not. Until you actually speak to a lot of patients, and a lot of skills, like till now, even though I'm on my 11th week of placement, you still need more practice. Like sometimes they just come with time and practice. So I think I was a bit overwhelmed at the beginning of my placement. Like, oh, like I thought I would be better at communicating, some stuff like active listening and all those skills that Estelle mentioned, but then they just come with practice. That was a real thing I realized on placement. And also with communications, it's not just always verbally. Sometimes you need an interpreter with you. So it's like you're sitting with the patient and you're on the phone with an interpreter trying to like communicate with the patient through the translator, but still having all that professionalism, that communication skills, the active listening, and so on. And you're also going to get patients who probably can't hear or have some like issues with their hearing. And then I remember once, one of the patients, I had to scream, but even with screaming, he still couldn't even hear me. And I had to do the whole consultation through writing. So it's just like being also open that communication isn't just, you can't just sometimes speak to the patient. And as Laura sometimes said, language, or that patient might have dementia. So it's just very wide, the whole communication skills, and it doesn't come like that. It takes practice and it takes time and it takes a lot of exposure to things. So yeah, that's just what I wanted to add on.
Okay, moving on. So the next question is for all of us, and it's which members of the MDT, so for those who don't know, MDT is the multidisciplinary team. So which members of the MDT do dietitians work closely with? Who's going to go first?
I think I can go as a student and what I think, and maybe Estelle, you can give us the view of it.
Great.
I think everyone. We play a role, like the whole MDT plays a big role, and we all need to be working together to give such patient-focused and patient-centered advice and care. But so far from my own experience, the MDT that I've actually had like contact with are nurses, doctors, sometimes physiotherapists. And yeah, that's just so far my personal experience. But of course, we all play one big role working together as part of an MDT. And yeah, we're all important.
And I'd say, so when I'm kind of reading up on a patient, I'll read the notes from the ambulance service on why they were admitted. There's the HCAs and the catering staff who record how much people are eating, which is so important to work out someone's nutritional intake when, so whoever's on the ward at the time will write on a food chart how much the patient has eaten, it's so important, because if someone's eating a quarter of a yogurt, it's really not going to benefit them nutritionally. And if we didn't know, it might just say that they'd eaten yogurt, and it's just so important. I'm so grateful for those people. The nursing notes, again, you can learn so much about patient from the nursing notes at the end of the bed. The people who fill in the fluid charts. I'm still really intimidated by the doctors, so I haven't done that yet. And the speech and language therapists as well. They will assess whether people have a safe enough swallow to be eating proper food. So say if they've just had a stroke, they may not be able to eat solid foods like you or I could. They may be on a reduced, I think it's called minced and moist, or a different textured diet. They may have thickened fluids because water may be too runny for them to be able to swallow normally. So there's so many people. The MDT are just really cool.
Yeah, definitely. I'd have to agree with all of that. I have to laugh as well at you saying, obviously, still being intimidated by doctors. I just remember being a student on placement, and when my supervisor would be like, "Do you want to hand over to the doctor?" I'd be like, "Oh no, no, I don't want to do it." So I'm glad to say I'm at the stage where I've no bother speaking to the doctors, and I'll definitely stand my ground if I don't agree with their plan, which is quite a nice feeling. But yeah, again, obviously it can be quite intimidating. So yeah, working with everyone within the multidisciplinary team is really important. I think as a specialist dietitian, it can vary a bit. So for example, if you're to specialize in, like, say, oncology or like head and neck cancer, it would be a very specific specialist MDT. Whereas because I'm still a band 5 dietitian, I just kind of interact with the general MDT that support the patients that I see, and it's not necessarily, a specialist team. So yeah, working with medical teams, obviously kind of checking in, what's the clinical plan for the patient, often with tube feeding patients or patients requiring parenteral nutrition. So in terms of tube feeding, we would support patients by, devising a regime. So they would put the tube feed in the patient, either a nasogastric tube, which goes in the nose and down into the tummy, or nasojejunal, which goes a little bit further into the jejunum. Or patients who are fed long term are fed directly into the stomach or the small bowel. And although that's obviously, a medical procedure, inserting the tube, etc., we would support those patients by choosing the feed that's appropriate for them, the rate, etc. And for example, with tube feeding patients, speaking to the medical team is really, really important to let them know, what our plan is for the patient. And again, with parenteral nutrition, that's when we feed patients intravenously, so into their veins. And that's actually quite complex. So with those kind of patients, again, really, really working with the medical team. And I've actually found, I've liaised quite a bit with pharmacists for patients who potentially with tube feeds, they might need some of their medications changed, or, they might be at risk of blocking the tubes, etc. So I might speak to the pharmacist about that, or patients requiring that parenteral nutrition. Speaking to pharmacy aseptics, because they're the ones who actually make up the bags. So I suppose before I started as a band 5 dietitian, I didn't even really consider working with pharmacists, but actually as you kind of progress, it's quite important. I think it goes without saying that nursing staff are obviously really important. We hand over our whole plan to the nursing staff at the end of an assessment, and prior to an assessment we might check in and say, oh, how's that patient getting on with their diet, with their tube feed. And yeah, it's obviously really important as well to check in with the healthcare assistants and catering staff as well, as was previously mentioned, because they're actually the ones that spend, well, not the catering staff, but the healthcare assistants are the ones that spend the most time with the patients. Sometimes, for example, with dementia patients, they're actually helping to feed the patients, so they know exactly how much food they've managed, or checking whether, they've managed their supplement drinks as well. Often the healthcare assistants can tell you more than the nursing staff at times. So it's really, really important that we don't overlook that as dietitians. Again, we're working with catering staff. If patients need like extra snacks and things, we can liaise with housekeepers on the ward. And they can be really, really beneficial. Yeah, I work quite a lot with speech and language therapists as well. So they often do the swallow assessment. So yeah, patients who, need texture modified diet or fluid, I would kind of check in with speech and language. And often patients who require tube feeding due to swallowing issues, the speech and language therapist will see them first, and then they'll, maybe give me a call and say, oh, Estelle, this patient is going to need a tube feed, they're not safe to swallow. So I think it's having, really good relations with speech and language can be quite helpful. And again, physios as well. I think Amira mentioned physiotherapists can be really helpful, especially patients who aren't mobilizing or who are potentially bedbound and we don't have weights for them. I've, reached out to physios and said, oh, next time you're helping to mobilize this patient or transfer this patient, can you please try and get a weight for them? Because often we're having to, estimate weights for patients if appropriate scales aren't available. And again, I suppose with patients who are malnourished or at risk of malnutrition, they're going to have that decrease in muscle mass. And, that mobilizing with the physios is going to help to build that muscle, and that kind of ties into nutritional status as well. So we can definitely work together with physios, and through supporting a patient nutritionally, it will help to build up their strength as well. And I'll often say that to patients who, have evidence of muscle wastage. I'll say, oh, I know you're mobilizing with the physios, improving your nutritional status, or building up your muscle mass will help with that, will help with your mobility. So yeah, I think, as was said previously, working with all members of the MDT is really, really important, and it is very much that kind of team approach. And I think it is really important to build good relations with them, with all members of the MDT if possible.
Yeah, absolutely. And we also have the OTs, the occupational therapists.
Yeah.
And I think something I haven't thought about till placement again was you can give a patient a oral nutritional supplement. For those of you who don't know, that's a prescribed drink for patients that are really high in calories and protein to help people that maybe are at risk of malnutrition or aren't quite eating enough. But if they're in a plastic bottle and if someone has arthritis in their hands, there's no way they're going to be able to get a really tight lid off. And some of them are powders that you whisk up with milk. And again, if you have arthritis in your hand, you may not be able to mix things up. So the OTs are so valuable in assessing kind of the level of mobility and the access to everything if and when they're discharged home. So yeah, I wasn't really aware of what OTs do until, again, I was on placement. So yeah. Okay, moving on. So we're going to talk about career progression. Obviously, Amira and I don't have a career yet, so Estelle, it's probably best for you. You can maybe explain how, like, the difference between band roles as well.
Mm-hmm. Yeah, definitely. So I think firstly, it's probably important to say that there's many different kind of avenues that dietitians can go down in terms of career paths. So I suppose we're very much talking about it from the perspective of being a clinical dietitian and working in an acute hospital. Some dietitians might, go into private practice, but that's usually down the line when they've kind of had that clinical experience. Some dietitians might work in community settings, so that's going to be supporting patients out in the community. Some dietitians might actually specialize in things like public health or sports nutrition, even things like, I'm trying to think, food industry as well. A lot of dietitians might go into that too. Some dietitians might actually go into research, so they might go on and do like masters and PhDs and then go into academia. So obviously our lecturers at uni are going to have that kind of background, but most dietitians will start off in one way or another in a clinical setting. So yeah, I suppose once we've kind of finished our undergraduate degrees, or we're approaching the end of our undergraduate degrees, we can start applying for jobs. So I applied for my first job, it was around March 2020. So that was before I actually sat my final exams. And I'd actually moved home to Ireland at this point. It was the start of the pandemic, and I was like, oh God, I'll have to move back to the UK and get a job. So I actually did my interview over Zoom, which I think some places are still doing interviews over Zoom at the moment. And yeah, I was offered my first job after my first interview, which I was very fortunate to have done. A lot of my friends did numerous interviews. I think there's absolutely no shame in doing more than one interview. And I think, if you don't get offered the job somewhere, it just obviously wasn't the right place for you. I think we're quite lucky as dietitians in the UK. There are quite a lot of jobs going at the moment. I know it's a bit different in Ireland. I know some people are actually to move over to the UK for jobs. So yeah, I started my first job in July 2020. So I've almost been working for a year. Well, it's been 10 months. So I started off, as a band 5 dietitian. So all graduate dietitians start as band 5s. And if you work in a larger teaching hospital, it's usually rotational. So some of my previous course mates are in larger hospitals, and they might do like 6 months in gastro, 6 months in surgical, another 6 months in renal, and they're kind of getting that wide kind of overview of different clinical areas. For me, when I started, it was just kind of a mix of everything, and that was just situational based on the fact that I was in a smaller hospital. But I think there's definitely pros and cons to both. I definitely gained so much experience of being in a smaller team, and I definitely stepped up, having to cover for staff absences, etc. So in a way, I feel like I did gain potentially more experience than people who were within set rotations. And then, some people go into community settings. So that's a lot of like outpatient clinics and home visits and stuff like that. And then after a while, you can specialize as a band 6 dietitian. So band 6 is specialist. And And it's kind of standardized throughout the NHS. So it's the same for all other allied health professionals. You always start off as a band 5 and then you can move up. So band 6 specialist is, next level up. It can kind of, range across a variety of different specialities. So you can have, specialist renal dietitians, gastro, surgical, like cardiac, respiratory. I'm trying to think, critical care. There are so many different specialities, and you'll definitely find in the larger teaching hospitals, there's many different opportunities. And then I suppose, as I mentioned earlier, about that kind of specialist MDT, for example, if you're working as a specialist diabetes dietitian, you're very much within that team with the diabetes nurses and the consultants, and the other AHPs involved in that, such as, podiatrists, etc. And then following that, band 7 is highly specialist dietitian. It can also be, team lead level. So some dietitians are band 7 without being a team lead. It just means they're very highly specialist in their fields. For example, the band 7 dietitian that works in my hospital, she's our team lead, and she kind of manages, all of our annual leave and our caseloads and all that kind of stuff. And then band 8 is band 8 is kind of the highest you can go. I think band 8C is the very highest. Band 8A might be like divisional lead for dietetics. So that's quite high up. That won't be for another good while. But yeah, I suppose in terms of progression, I think everyone progresses at a different level. And I think one thing we were always told at uni is not to jump, necessarily too quickly to a band 6 role, but as a band 5, you can just gain so much experience in different areas. I suppose my own experience, in the band 5 role, I've just learned so much. And actually, I suppose I may as well say it on here. Well, I was offered a band 6 job recently. I actually only accepted it yesterday, but in gastrosurgery. So that is quite soon after graduating. So by the time I start, it'll be a year after I graduated. So I was just quite fortunate that I landed one that I was quite interested in. But again, if one hadn't come up that I was interested in, I would have just, kept going as band 5 for maybe a couple of years and gained all of that experience. So yeah, I think everyone's journey is different, but there's definitely loads of opportunities out there, and the career progression is really, really good.
Congratulations.
Thank you.
I would also just like to add, so as I mentioned at the start, I'm at Cardiff Metropolitan University. So that's the only university in Wales that does dietetics. And they also have a Welsh NHS bursary. So you don't have to accept it, but I am currently on it. And it means you don't have any student fees, but you have to agree to work in Wales, but following the first 2 years after you graduate. And again, the interviews are all slightly different. So you have your own interview, and all the dietetic teams from across Wales will watch your interview, and you kind of, they like rank you and score you, and it's really intimidating, and I'm not thinking about it. But yeah, I just wanted to add that it is slightly different for Cardiff Met because of the Welsh NHS bursary. Yeah.
That sounds really intense.
I didn't have to think about it yet, so it was good. But it means it's only one interview, I guess.
Yeah.
I really can't add to anything because I'm at that stage of my life where I need to start applying to jobs. So we'll see how that goes.
Yeah, so that's the kind of almost the end of all our questions. So just want to open the questions up to everyone watching. So if you have any questions for us, just pop them in the chat and we'll read them out and answer them if we can. We'll do our best. But whilst we wait for some questions to come in, look at that. Question for Amira: how to make the uni application strong as an international student?
That's a good one. So just to give a brief background about how I studied dietetics. So I was more of like coming from an American high school. So I didn't do any of the A levels or anything else. So I had to do a foundation year at King's. And then after doing that 1 year at foundation, I applied to go to dietetics. And so I just think you need to show it in your application. Like you have to think about it. Why would they want to choose you? You know what I mean? I mean, don't make yourself seem so much like as an international, I would be treated differently. But it's just the same thing. It's just doing a whole application. Your statement should be like proving to them why, from everyone, why should they choose you? just putting any work experience you had, any interest of yours, anything, any of the skills you acquired through anything you've done, basically. Like, let's say, for example, you were in high school, you were in a sports team, so that way you got some teamwork skills. So that would be amazing to add, because as Estelle said, teamwork is really important. So I think taking skills from other things that can be dietetics related or non-dietetics related, and like putting it into how can you contribute to the team, or how would you make a difference, basically. And just saying that, and just wanting just showing them why you're interested in that course, basically. But just don't put it in your head that, oh, I'm an international, I should do things differently. Because in the end, when they read the statement, they wouldn't look at your background, they're just reading your statement. So I think don't worry about that, and best of luck.
Thank you. Okay, so next question. Is there a lot of office work and sitting down, or can the job be quite active in the hospital? So I can try and answer this one. So I found on the days when I am in the hospital, it is a lot of walking about, moving about the hospital, because I think especially as a band 5, you may not be specifically on one ward, so you may have a couple of patients across all corners of the hospital, and it's something I actually quite enjoy. You get to see the whole hospital, you kind of get to understand where everything is, and you get to meet all the different staff from all the different wards. There is some office work, as we said earlier, looking at people's bloods. You do quite a lot of kind of reading up on the patient before you even go and see them on the wards. And then you've got the write-up, which you will probably, I mean, what I've seen is you write up patients on the wards, unless you're community, or maybe you're doing online clinic, which is then you'd be sitting down and writing it up. But I personally find it quite active. You need some good comfy shoes when you're on placement, because you'll be walking a long way.
I absolutely agree with this. It's going to be active for sure, because you're going to be running from the office to the wards, to speaking to the nurses, looking for the medical team. So it's absolutely not just an office desk day, but there are some days that could be more active than others. But for sure, there's some activity going on. That's also how my placement's going like.
Mm-hmm. And then next question, probably best for Estelle. Mm-hmm. What is the most stressful part of being a dietitian?
It's a difficult one. I think probably managing a very busy clinical caseload, dealing with staff shortages, which are always the case in the NHS. It's very busy. So you don't usually get to relax that often. You know, it can be quite hectic at times. I think sometimes, you know, with more complex patients, having to obviously liaising with the MDT, you know, can be a great experience at times. You know, sometimes it can be quite frustrating, maybe getting our point across to medical teams, because ultimately they have the final say, and that might be, you know, whether a patient is appropriate for tube feeding, for example. And it is, I guess, just really important to kind of stand your ground as a dietitian and just really kind of emphasize your point of view. So I suppose I do find that quite stressful at times. And I guess doing additional things alongside the role. So for example, we do like non-clinical audits and projects, and having that time, I guess we don't really have the time to do them. So kind of, you know, doing it here and there, you know, whenever I can is quite important. But again, it can be quite stressful to manage that on top of a busy clinical caseload. But yeah, probably caseload shortages. And what is the most enjoyable? I think working with patients, I'd have to say, and I think most dietitians would say this, you know, just being able to speak to patients, perhaps, you know, they haven't really spoken to anyone that day. And I think during the pandemic with COVID, you know, visitors weren't allowed in up until a few weeks ago, actually, in my hospital anyway. And so patients are often quite lonely. They just love to have a good chat. So just being able to put a smile on someone's face, and that can be quite difficult as well when, you know, you've got all the PPE on and it's quite hard to build that rapport. But just like being able to maybe just brighten the patient's day just a little bit is probably the most enjoyable part.
Mm-hmm. Amazing. So next question, what sort of cases do you get to work with? I can answer a bit of this. I think this does depend on the setting you're in. So I've seen the acute wards, I've seen community, and I've also seen some outpatient clinics, which is kind of a bit of both. But in terms of cases, you have such a range, like you'll never see the exact same scenario twice. I've seen a lot of malnutrition because they've been mostly the wards I've been on. So the ortho wards or the frailty wards, there are a lot of old people, maybe with dementia, who kind of maybe forget to eat or are struggling to eat a lot. But yeah, as I said, every patient is so different. They'll all contribute different things when you go and chat to them. Some will be really bubbly. Some will have so many different illnesses, and some maybe might just not be eating. So there is such a range, which is what I love about dietetics. It's always so different. But yeah.
I think I've seen quite a lot now because due to COVID, my second placement was canceled. So what they did is they combined my second and third placement together. So on my second placement, it was like every 2 weeks we go with a new team. So I've been with pediatrics, bariatrics, I've been with community, and I've been so acute general medicine, gastro, currently with gastro. So I think it's just like, as Laura said, you would never probably see the same condition. I mean, same condition, but it's never the same patient story ever. So yeah, you just love the variety, and you would learn so much from each patient. So yeah, you'll be surprised about what you'll see. So yeah.
Okay, next question. What types of things do you learn on the degree specifically? So as a second year undergrads, what I've learned so far, first year was mainly a basing on biochemistry and anatomy. So it was making sure everyone on the course is on the same level in terms of the science of the human body and of nutrition. So it was looking at macronutrients and the components of food, and I had massive anatomy lectures with loads of different students from loads of different courses. I did get a few cookery lessons as well, which is definitely the highlight of first year, getting to take all this food I've made home from the kitchens. And then this year has been a lot more specialist, and we've had actually a specialist module which has gone through loads of different specialities. We've had public health dietitians come in and give us lectures, and we've looked more at nutritional illnesses this year. Can't say what's going to be in third year yet because I haven't got there, but that's what I've done. Amira, do you want to?
So at King's, it's a 4-year course. So I think the first 2 years are a bit more like kind of general. We did physiology, like food science, biochemistry, like human nutrition. So it was just more of like a general getting us into the settings of what's coming next. And then third and fourth year were more like specialized. Like we had a diet therapy, public health. So that's where the more clinical conditions come in, and the dietary aspects and all the evidence based towards it and the guidelines and everything. So if I would sum it up, it would be first 2 years would be kind of general, kind of, and then the third and fourth year would be very clinical focus and specific. Yeah.
Okay, moving on. So next question. Do you get a feel of what you would like to specialize in as the course goes on? And I will answer that. I think this is really personal and individual. Some people know absolutely what they want to specialize in before they even start the course. But a lot of people kind of go in open-minded, and you probably discover something you'll really love whilst on placement, which is what I'm hoping to do because I currently love every speciality. But yeah, it is really individual. Estelle, did you know what you wanted to do?
No, definitely not. I think I just try to stay very open-minded as a student, and I think it's really important as well because you don't know what specialities you'll be spending time in. So yeah, for example, on placement, I actually loved community and acute, but and I had actually considered community when I was on placement. I actually enjoyed my community settings more. But obviously I had got my first job in a clinical setting, and I really can't see myself going back to community anytime soon. And I guess, yeah, obviously the specialist role is in gastroenterology and surgery with some critical care. And if you'd asked me a year ago whether I would have specialised in those areas, I would have been like, no, not a chance. Because obviously as a student, it sounds quite complex. Things like critical care, you don't really get experience on. So it's only through kind of starting my role as a band 5, I've gained experience in gastro and surgery, and I've yet to gain experience in critical care, but obviously I'm really excited to progress into that area. And I think an important thing to say is that you're not going to stuck in one area either. So you can choose to specialize in one specific area as band 6 dietitian, and actually a few years later, if you decide, oh, actually I quite fancy trying this other clinical specialty, you can often move between jobs. And that's why, you know, dietetics is never boring. You know, if you find things are getting a bit static within a certain specialty, you can always move and progress within the profession. There's always so many opportunities to do that.
Yeah, absolutely. And off the back of that, how do you progress into a higher band? So I believe I'm going to say this right. So band 6, you can progress just with experience and knowledge, but to become band 7, you have to have a master's. Is that correct?
I'm not sure whether it's changed recently. I don't know whether you do need a master's. I think if you've quite a lot of, I think I mentioned earlier the different types of band 7. So if you're like a band 7 team lead, I think it's just clinical experience, but you do need quite a lot of clinical experience. But maybe if you're like a band 7 specialist within gastro, for example, you might be expected to have done further study. I think it just kind of depends on the hospital and kind of the standards that you're required to meet. So I think it could just depend. But usually you can just progress with experience.
Amazing. Thank you. Okay, next question. So looking for some interview tips to getting into uni.
Oh God, that seemed ages ago. I think the way my interview ran was like, I had 5 mini interviews and each one said something. I remember one of them was just like, gosh, I don't even remember my interview. I might not be the best in answering that question, but I just think like they know that you don't have the best clinical knowledge yet, because that's what you'll get during the course and not before. So don't stress too much about knowing the clinical knowledge about it, but it's more just showing them why would you be appropriate for this to get into the university or being a dietitian. For sure, they're going to ask, why are you wanting to be a dietitian? The most commonly asked question. So I think just revolving around that, like what made you go for that course?
I think it can definitely depend on the university as well. So I did a few different interviews. So for example, one of them, the first aspect of it was actually group based, and you were put into groups and you were given like case studies. And I guess actually what they're looking for there is not necessarily the answer you come up with, but actually how you interact within a group. So they're looking to see your kind of team player skills and whether you're demonstrating active listening. And then the second component of that interview was a one-on-one interview. And the other interviews I did were just kind of one-to-one. And I guess, yeah, just kind of standard questions might be like why, you know, you chose to study or why you'd like to study dietetics, what kind of skills you can bring, you know, bringing up about the MDT might be asked a specific question, but if you're not, I would try and make a specific point of that. And I suppose just showing that you've done some further reading around the role. Any volunteering opportunities as well are fantastic. So I'd say if you're looking to apply to university, firstly in terms of the application and the interview, having volunteering experience would be really helpful, or any kind of work experience. But I know at the moment it's quite difficult during the pandemic getting work experience in a hospital. But I know some students who have kind of rang dietitians, maybe had a phone call with them and kind of asked them about their role and kind of put that down as like a telephone interview. So you could potentially look into doing that if you're unable to get, you know, actual face-to-face shadowing, or even, you know, little CPD things, that's continuous professional development stuff, like even, you know, attending this webinar again, that's something, you know, you can literally put on your application or bring up in an interview. So I think, yeah, firstly working towards application, but then using what's in your application in the interview and just elaborating on it a bit more.
I have nothing else to add. That was so elaborate. So that was also the perfect transition into the next question. Did you get work-related work experience? That doesn't make sense. Did you have work experience? So for me, I was actually really fortunate. I had 2 separate weeks in 2 separate hospitals shadowing dietitians, but I think that's quite unusual. And yeah, so as you said, it's really hard to be able to get into a clinical setting at the moment due to COVID. But yeah, I really like the idea of ringing dietitians. That's really clever. And you could look into if there are any local private dietitians or maybe public health dietitians that you could probably shadow online if they were willing to. Again, you have volunteering. So I volunteered in a care home for almost 2 years. And yeah, just show you're really passionate about dietetics and looking after people, and during your interview your lecturers will be able to tell if like this is the right career for you, and if you have that passion, then yeah.
And I think I agree with everything you said. Just try to find volunteering or things to do, dietetics related. But even worst case, if you could not find anything possibly that's dietetics related, anything else, you could kind of bring it in to getting the skills from any other non-dietetics related. You can also adapt and take those skills with you and use it in dietetics. Because I don't remember, I haven't shadowed in a hospital. I have not basically done any health or dietetics related volunteering. I think the only thing I did was like bake sales or like helping raise money for a charity. That's what I think I did back in school. But I took skills from what I did there and put it into how I would use it in dietetics. Or like when I was in the sports team, I'm going to use that teamwork, that leadership, and take it into dietetics. So it's not, if you couldn't get dietetics volunteering, don't stress too much about it. You can use other stuff and just use that skills and bring it into dietetics.
Yeah, absolutely. And I think some hospitals are offering like an online shadowing day, where all prospective students can go and watch. I don't know which hospitals, but I do believe that is a thing. Okay, next question. We're almost running out of time, so try and power through. What late A levels are prepared for a degree in dietetics? This is dependent on the uni, but usually it will be biology and chemistry. A lot of unis have foundation year courses if that's not your background. Again, there are probably quite a lot of mature students who may not have done those A levels a few years ago. So yeah, that was what it was for Cardiff Met. I'm pretty sure biology and chemistry, but don't know about you two.
Yeah, to be the same for Ireland as well, biology and chemistry. We do a lot more subjects in the leaving cert. So kind of Irish, English, maths and a language are mandatory. But in terms of optional subjects, biology and chemistry are usually required, especially in the UK. So yeah, making sure to choose both of those.
Same here. In my foundation year, I have to do bio and chemistry as well.
Okay. Question for Estelle. Did you struggle leaving Ireland? I have a few interviews for masters in the UK, but I'm scared to leave my family. Thank you.
Oh, yeah. So I moved over when I was 18, which is quite young. I kind of made the decision when I was 17, though, that I kind of wanted to move. And part of that was probably kind of getting out of like small town in Ireland, kind of wanting to get over to the UK. So when I first moved over, I was actually really excited, couldn't wait. And definitely the first kind of couple of years were very much like that. I guess it just kind of, yeah, tends to kind of settle in that you're really over in the UK for, a good 4 years of an undergraduate degree. And I suppose it wasn't too bad because I could fly home quite regularly. So I used to fly home like every 6 weeks. I was such a home bird. But I can really appreciate that now things are different with the pandemic. So for example, when I first moved over here for my job in July, I didn't actually get home. So I didn't get home for Christmas, just with everything with COVID. And that's been really, really challenging. So I think in terms of like doing a master's, if you know that that's only going to be like 2 years and then you can potentially just move back to Ireland after that, or even like stay on in the UK for like a year or two to gain experience. And I'd say it's definitely worth it. And hopefully things will be lifting with the restrictions, but I can definitely appreciate that, everything going on with the pandemic has added, an extra barrier to doing that. And I think I was probably quite fortunate that I was quite young when I moved over. So I didn't have a partner that I'd be leaving behind. It was, obviously I left behind my family and friends, but I was able to go home and see them quite a lot. So yeah, I guess it's kind of individual, but I guess, yeah, it just depends. I know there are a lot of masters starting to open up in Ireland now, which weren't really options when I was a student. So that's quite positive as well.
Amazing. Okay, I'll do one more question. So what placements did you do in the community setting, and this person's interested in public health? So public health and community are actually separate specialities. So in terms of public health, the things that I've seen so far is In Wales, there's a community programme called Nutrition Skills for Life, and public health dietitians run this course, and essentially they teach primary school teachers basic nutrition, and these primary school teachers can then run summer schools in basic nutrition, and they do cooking, and they get the children's parents involved. So last week I was able to watch the training session. It was all on Microsoft Teams, but that was really interesting, and the public health dietitians are so passionate about helping people. They are amazing. And then in terms of community, I've been out to a community hospital, which was in the valleys. It was quite a drive away from where I'm currently based. And that was more, it was like a 20-bed hospital. It was really small, and it was people who were recovering. They'd been discharged from hospital, but weren't quite ready to go home. And other community things I've seen would be phone calls home. So people who maybe been discharged from hospital, who maybe usually attend clinic, but clinics aren't happening at the moment. So community there's such a big range, and I did not realise that until placement. Yeah, do either of you two have anything to add?
Yeah, as a student, I gained some experience in public health nutrition, just, because I was kind of interested in it myself. So I volunteered with a charity in Edinburgh that kind of facilitated like nutrition stalls across different hospitals in Edinburgh. And we also did like cooking classes with socioeconomically disadvantaged parents. So that was a really good experience. And I absolutely loved it. And, at the end, they kind of said, you could, consider this as a career, kind of going into public health, but obviously my heart was kind of set on staying within clinical settings. So I think if you're kind of interested in public health, it's still quite important to keep an open mind in terms of the clinical side of things, because obviously you'll still have to do clinical placements. But yeah, there's definitely opportunities for public health. I'd say it's worthwhile speaking to some registered nutritionists, because often a lot of nutritionists will work in public health. So yeah, kind of finding out more about their roles in terms of like contributing to public health campaigns and stuff like that. And then in terms of community and my community settings, I was based in weight management for a bit, which was really interesting, diabetes as well, and the nutrition support team. So I just spent a bit of time with each of the teams, but most of my clinical experience on placement was in an acute setting. And I suppose it is worthwhile mentioning as well, weight management. Often, lots of misconceptions about dietitians telling people to lose weight and that's all we do. Actually, it's quite rare within my role that I will give weight management advice, potentially on the cardiac unit, I might give it now and then, or with diabetes, but actually weight management is a very specialized service, and it's often kind of like band 6-7 dietitians that will provide that, some band 5s as well, and it's usually done in an outpatient setting. So I did actually love my time with weight management, but it's within a very specialist MDT. So you've got, the clinical psychologists, specialists, even bariatric nurses and consultants. So it's quite different, I guess, to that acute clinical setting.
Okay, so that is all we have time for. But before you all go, we're really sorry to everyone whose questions we didn't get around to, but we can just share our Instagram handles. So if you want to forward those questions on, well, I'll be happy to answer them. I don't know about the other two.
Yeah, definitely.
So mine is at Elfie_living. I'll put it in the chat.
Mine's at Your Health Things, which I'll also put it on the chat.
Yeah, and I'm under Estelle Dietitian, so I'll put that in the chat too.
And if you've got time, there is a QR code just coming up on the screen. Next page. If you could give us some feedback, that would be really lovely. This will go to the team at Future Frontline, so we can continue providing these webinars for free. And this will be available on YouTube to catch up on if you've missed the start, or so we will put on the Future Frontline page when it's up on YouTube. But yeah, other than that, thank you so much for coming.
Thank you, everyone, and I hope you found this useful.
Yeah, thank you so much, everyone. And if there's any other questions, as we said, just drop us a DM on Instagram. We'll all be happy to answer any questions that come up. And yeah, best of luck to anyone who's looking to apply for a dietetics degree. yeah, best of luck, everyone.
Okay,
Thanks for joining.
And stop recording.